Hello, my friends. I'm Dr. Eva Danial, a urology and men's health expert. Today, we're going to have one of those open, honest, and yes, slightly blush-worthy conversations. It's about a question many people carry silently but rarely get to discuss openly. I believe it's time to bring these questions into the light because when we talk honestly about intimacy, we don't just learn, we heal, we connect, and we realize we're not alone. So, welcome to this space, a safe, respectful corner of the internet where we talk about sexual health, confidence, and intimacy at every age. Whether you're tuning in from a busy city apartment, a quiet garden, or a retirement community, this conversation is for you. Here's the truth. Intimacy doesn't retire. Passion doesn't have an expiration date. And love, when cared for, only deepens with time. Let's go right into today's big question, one I get far more often than you might imagine. I know some of you may feel a little shy just hearing it. The question is this: is it safe to swallow vaginal fluids during oral intimacy? What about the taste, the smell? Is it normal? Is it healthy? These are questions whispered in private, searched late at night, or asked hesitantly in my clinic with lowered eyes. But here, we're going to talk about it openly, without shame, and grounded in science. I want you to stay with me, even if you feel a little embarrassed, because by the end of this, you'll feel informed, reassured, and more confident in how to approach intimacy. Oral intimacy is no longer the taboo it once was. Today, many couples, even in their 60s and 70s, are discovering it for the first time and describing it as opening a brand new chapter in their relationship. But as with all intimate practices, it comes with responsibility. Anything that enters your body or your partner's deserves knowledge and care. So let's start with the fundamentals. What exactly are vaginal fluids? Are they safe to swallow? What determines their taste and smell? And most importantly, how do we keep intimacy not just pleasurable, but safe, respectful, and affirming? First, what are vaginal fluids? They're not random moisture. They're the body's natural masterpiece, carefully designed to reduce friction, protect delicate tissue, and signal readiness for intimacy. Even beyond fertility years, these fluids remain essential for comfort and pleasure. They come from three main sources: the Bartholin's glands, which secrete fluid at the entrance of the vagina to reduce friction; the Skene's glands, sometimes called the female prostate, which produce additional fluid during deeper arousal; the cervix, which contributes fluid that helps maintain balance and moisture. Together, these create a lubrication that may be clear, milky, or somewhere in between. Think of it as nature's way of preparing the body for connection. Now, let's talk about taste and smell. Just like sweat or saliva, vaginal fluids vary naturally. Hormones, hydration, diet, stress, and medications can all influence them. For example, a diet rich in fruits like pineapple or citrus can lead to a lighter, fresher taste, while garlic, onions, or alcohol might make it stronger. Hormonal shifts around ovulation, menstruation, or menopause also bring natural changes. I want you to remember, none of this is abnormal. A woman's natural scent and taste are part of her individuality. But if something feels off, it's not a reason for shame. It's the body signaling something, like a common and treatable imbalance such as bacterial vaginosis or a yeast infection. Now, the big question, is it safe to swallow vaginal fluids? For healthy partners, yes, generally it is safe. Vaginal fluids are not dirty or toxic. They're mostly water, along with amino acids, enzymes, and minerals designed to keep the vagina healthy. However, like semen or blood, vaginal fluids can carry sexually transmitted infections such as chlamydia, gonorrhea, herpes, or HIV, especially if the receiving partner has open sores, bleeding gums, or ulcers in the mouth. This doesn't mean you live in fear. It means love and wisdom go together. Wisdom looks like knowing your status, having open conversations about sexual health, and making routine testing a normal part of intimacy. Safety doesn't destroy romance, it strengthens trust. When you and your partner know you're both healthy, intimacy becomes freer and more joyful. Here's what I recommend. Have the STI conversation gently. Suggest getting tested together as an active partnership. Consider using barriers like dental dams, especially early in a relationship. Make routine testing part of your health ritual. Twice a year is a good standard. If you and your partner are healthy and infection-free, then swallowing fluids is safe. More than that, it can be an act of deep acceptance. Many women feel more cherished when their partner embraces them completely. It says, "I trust you, I delight in you, I accept all of you." And let's talk about the emotional meaning. For many women, especially in midlife and beyond, acceptance is more powerful than technique. When a man embraces his partner fully, including her fluids, it heals years of quiet shame. It turns intimacy into trust, and trust into deeper pleasure. And when a woman feels that safe, her arousal deepens, her orgasms strengthen, and her presence with you multiplies. So is it safe? For healthy couples, yes. Is variation in taste and smell normal? Absolutely. The real key is communication, honesty, and compassion, because intimacy at any age isn't just about mechanics. It's about how deeply you make your partner feel safe, desired, and accepted. And before we close, I want to mention something important for men. So many guys waste money on unsafe and proven pills from the internet. That's why I only recommend safe, evidence-based options. You'll find them linked in the description below. For a moderate, clean boost, I recommend organic watermelon extract, rich in L-citrulline. It improves nitric oxide, boosts blood flow, and supports firmer, more reliable erections. But if you're looking for a bigger transformation, not just better circulation, but stronger testosterone, stamina, libido, and prostate support, then I recommend the advanced formula. It combines a carrion from horny goat weed for blood flow and hardness, Tonkat Ali for testosterone and libido, fenugreek for desire and energy, nettle root for hormone balance, and citrulline for vascular performance. Together, this formula supports every part of male health: circulation, hormones, stamina, desire, and prostate care. Whichever option fits your goals. You'll find the links in the description. Take care of your health, your confidence, and your intimacy, because passion doesn't retire, and neither should your sense of connection and well-being. Thank you for being here, for listening, and for investing in honest, healthy relationships.